The Heart Attack and Stroke Prevention Center is one of a kind in Spokane. Medical Director Amy Doneen speaks around the world about predicting and preventing heart disease and stroke by going beyond what is considered standard care for detection and risk. She says the testing and treatment provided here don't compete with that at other subspecialty practices.
So one thing that I've thought about over the years is, are we competing with cardiology or neurology or family practice, or where do we fit in? I mean, where do we fit here at the Heart Attack and Stroke Prevention Center? And what I like to relay to people is that we truly are unique. We are treating the vascular system, and so we do work with our cardiology colleagues, we do work with our neurology colleagues, and we do need all specialties to realize that we are all connected.
Connected by miles and miles of vessels woven throughout our bodies.
6,000 miles of vessels that feed nutrients, basically oxygen, to every vital organ in our body, from the tips of our toes to the top of our head, to our brain cells. So keeping those arteries healthy is really our key ingredient to wellness, and that's our job here.
A job that uses the Doneen method, which looks directly at the health of the artery wall. Standard ultrasound imaging looks at blood flow through the artery. By looking at the artery wall itself, medical experts can determine if the wall is thickening, an unhealthy sign and a precursor to plaque, and if plaque is already forming.
The focus and the health of the vascular wall, that's 100% of my efforts. And it does take education, because you know what, patients don't feel if there's plaque developing in the wall of their artery. In the last 10 years of doing this, I have yet to have someone knock on my door and say, Amy, I think I'm developing fatty streaks in the wall of my artery. No, but patients do come in and say, my gosh, I've had a heart attack or stroke. I have no kidney function left. Why is that? I wish that I had had my hands on them 20 years ago, when I could have said these fatty streaks have been developing for 20 years, 2 decades.
Precious time that could have been used to prevent those heart attacks and strokes with detection and follow-up lifestyle adjustments and treatments under the Doneen method. There are now more than 200 medical providers in the U.S. opening clinics like this one, in good part due to Doneen's tireless efforts at educating and training healthcare providers around the country. Doneen and the co-founder of the Doneen method, Dr. Bradley Bale, have recently written a book called Beat the Heart Attack Gene. Doneen has also been published in regional and national publications and interviewed on major radio and TV broadcasts. An international leader in the prevention of heart attack, stroke, and diabetes right here in the Inland Northwest. She and her staff want you to know about the life-saving service provided in your community, because it could be your life that's saved.